I think I'm probably the best value-based patient because, I don't want a checklist. I'm not a checklist. I've lived many, many years.
At Norton Healthcare, we've done a great job in terms of making sure that we have all the pieces in place, having that extra set of eyes to make sure we're hitting these important markers of prevention, so that way we are taking the best possible care of the patient.
I've been seeing Dr. Taylor about six and a half years, and a Norton patient for many years before that. Before Dr. Taylor, I had just a family practitioner, and as I grew older, I developed more health issues, and someone recommended that I go see an internist.
Back in 2020, Ms. Wilson had a hospitalization, which was very prolonged. We were there for
21 days.
21 days.
At a Norton's hospital, and I had all these people around me, and I thought, wow, there's something must be really difficult going on here because I had 5 or 6 people at my bed all the time. So I came through that very well. I've had probably 10 or 11 joint replacements, and I fell at work and broke my elbow, and I fell in my garden and broke my wrist, and so, but come to find out, a Norton's physician found out that my parathyroids were leaching calcium out of my body.
One of the things that Ms. Wilson remembered is that Humana Medicare had sent her meals following her hospitalization because they recognized that she was tired. She had just come home from the hospital and she would need that extra support in terms of meals. Obviously, we were calling to check on her, make sure things were going okay. Had a visit right after the hospitalization to review everything that happened and make sure that she understood what was going on.
I like to talk, and so I want her to know about, I woke up with a headache on the left side, and could it be a brain tumor, whatever.
So it ended up being this very terrible hospitalization, but we made it through it, and we made it through it together.
And as I grow older and I've had more serious health concerns, I feel very comfortable.
Well, I think it's definitely made my patient visits a whole lot more holistic, fully integrated for the human that is sitting in front of me and not just the medical conditions, and doing the best I can for the patient who is in front of me.
I'll be 72 in 3 weeks. I'm going to be around for a little bit longer.